Hello friends, welcome to Creative Medicine. In this lecture, we will learn about not true about clozapine. Clozapine should be discontinued if the WBC count is less than 33,000 per millimeter cube. True. It should be discontinued even if the neutrophil count is less than 1500 per millimeter cube. Blood levels should be less than 350 nanogram per ml to avoid granulocytosis. Remember, actually, agranulocytosis is an idiosyncratic reaction. Agranulocytosis is an idiosyncratic reaction. Idiosyncratic reaction means that this is not related to blood levels. So, blood levels are not maintained, need not be maintained. Okay, this is false. Should not be used along with carbamazepine. True. The action is more on D4 receptors than on D2 receptor. Why should it not be used with carbamazepine? Because actually carbamazepine also causes aplastic anemia, or it is also a bone marrow suppressant. Okay, and this clozapine is contraindicated with bone marrow suppressants. Okay, so we do not use clozapine with carbamazepine. Thank you, and thank you for watching.